Thank you, Teresa. And thanks to every one of you and for the organizer to organize this is a fantastic thing. I actually found out this morning that today in Europe they're having a stem cell day. It's called Unistem. It's sponsored by Unistem, so I think it's quite a coincidence, and I think it's nice that we're engaging with the public and university throughout the world to discuss this. Of course, I'm a stem cell biologist, so I'm going to argue for the stem cell use of cells that are pancreatic cells derived from the embryonic stem cells or pluripotent stem cells to treat type 1 diabetes. And as you heard from Derek before in the introduction, the current treatment for type 1 diabetes is insulin injection, either by needles or with pumps, which you will hear in the second debate. But this treatment is not very efficient because we cannot control in real time the sugar concentration in your in the blood. And this is the job of the beta cells. The beta cells in your pancreas is constantly monitoring the sugar level in your blood and constantly adjusting. So if there is too much sugar, the beta cells releases insulin. Insulin is like a message, goes to the other organs and say, there is too much sugar in your blood, take it up. So if we can substitute these beta cells that is destroyed in type 1 diabetics patients, then we can cure the disease. And we know we can do this because transplantation of the entire pancreas or the islets, as you heard before, which are isolated from the pancreas, works. But it doesn't work for a long time. As you heard, after 5 years, usually a patient needs to have another transplant of islets unless they receive the whole pancreas, which is usually more successful. But the problem with that, there's two problems with that. The first problem is immunosuppressants. Immunosuppressants are very harsh drugs that you don't want to give to patients with type 1 diabetes. It's actually better to be on insulin treatment rather than having immunosuppressants. So only patients that are really sick and cannot control their blood glucose with insulin injection will be candidate for all pancreas transplantation or islet transplantation. The second biggest problem that we have with the transplantation is that we don't have enough donors. Even if you want to cure, even if everybody in the world decides to become a donor after their death, we will not have enough patients, we will not have enough donors to cure every patient with type 1 diabetes. So how are we going to address this? We're going to generate cells from pluripotent stem cells, and that will allow us to generate an unlimited source of beta cells that can cure type 1 diabetes. And we know we can do this. And when I say this, is because this is not the future. This is happening now. It's not science fiction. We can actually do this every day. I do it in the lab, not this tower here, but on the other side at Mars. And if you ever become interested in science and you want to come and become a summer student in my lab and maybe graduate students, I'm here now promoting my lab, you can come and I'll teach you how to do this. We take an embryonic stem cells or an iPS cells, which is, as Dr. Elia Piccinin showed you before, as cells from you, any one of you here, that I can revert to become embryonic stem cell-like, and we can convert it into a pancreatic cells. And as of last year, 2 groups, one in Canada and one in the US, showed that we can actually make beta cells in vitro. And we've been able to reproduce that. So what we're doing now is taking these cells, either a cell that can become a pancreatic can become a beta cells, or in the future a beta cell itself, and we can transplant it into patients with type 1 diabetes to cure the disease. And again, this is not the future, this is already happening. There is a clinical trial undergoing right now in the States, treating patients with this type of cells, treating patient with type 1 diabetes with this type of cells. And very soon, I expect that Canada will launch the same clinical trial. The FDA approved the trial in the US, and Health Canada has approved the trial in Canada. It hasn't started yet, but I think it's going to start very soon. So you can see how this is not a question of how and whether we're going to do this. We're going to do it, and we're just going to get better at this. And the best, the best side of this is that we're going to put these cells inside a device. Imagine this device to be like a tea bag, where you're going to have the cells inside the tea bag. They're protected from the immune system that would normally attack the cells, but they can sense the sugar coming through the pores of the membrane and can release insulin into the bloodstream. So even if something goes wrong in the cell preparation that we put into a patient, we can figure it out and remove the tea bag from the patient. So, when I heard from Teresa that my opponent was Derek van der Kooi, I was a bit scared because he's the hardest person to debate against. But as you can see, this argument is pretty strong. So I'm actually looking forward to hear what he can come up with. And, please stay on my side. Thank you very much. I'll take questions after Derek's talk.